Welcome to the Jewish Orthodox Women's Medical Association, or JOMA podcast. I'm your host, Elisa Minkin. I am a general pediatrician and proud JOMA member, and I'm really honored and really excited to be here today with Dr. Esther Fogel. Hi.
Hi.
Thank you so much for doing this with me. So Dr. Esther Fogel is a clinical audiologist. She is the owner and director of Comprehensive Audiology in Lynbrook, New York. She received a master's degree in Speech Language Pathology from the University of North Texas and a doctorate in audiology from the Graduate Center of the City University of New York. She completed her residency in audiology at the Long Island Jewish Medical Center's Hearing and Speech Center. She is a fellow of the American Academy of Audiology and a member of the American Speech and Hearing Association. Dr. Fogel's areas of expertise include diagnostic, audiological evaluations, hearing aid fittings, auditory brainstem response evaluations, cochlear implant evaluations and mapping, and fitting of custom hearing protection. Dr. Fogel's mission is to provide a comprehensive approach to her patients' hearing healthcare. In her practice, Dr. Fogel assesses each patient individually using the latest state-of-the-art diagnostic tools and presents a personalized rehabilitation plan to fit each patient's needs. So that's amazing. And it's really impressive that you have training in both speech and language and audiology.
Correct. So that gives me an aspect of dealing with my patients, not just from an audiological and fitting of hearing aids, but how it affects their overall daily communication and speech, whether it be for children or adults. So I really get the full view of each patient's needs.
It's amazing. And what ages do you care for patients?
So I see patients across the lifespan, from children all the way up to adults and elderly.
Wow.
Mm-hmm.
So I did talk a little bit about hearing loss in young children in a talk with Dr. Catherine Geller, who is a pediatric ENT, called Now Hear This. This is when I hear you. I'm running out of titles. But it's a really important topic, and I really barely grazed the surface. But I think we're going to probably end up focusing more on adults because I'm a pediatrician and I always talk about children, but I need to talk about other people. So I'm going to give you a chance to start with prevention, because that's, really one of the goals of this podcast series is prevention. So what can you tell us about preventing hearing loss? Because it can be prevented.
Yes. So noise-induced hearing loss is the type of hearing loss that can be prevented. Now, noise-induced hearing loss is permanent and irreversible. So it's important that we take the steps to protect our hearing. And I know you were interested specifically about events such as weddings, bar mitzvahs, and all types of loud events such as that. And it's important that either if you're the host of the event, to ask the band to lower the volume a little bit, but if you are a guest, to either wear hearing protection or stay far away from the speakers. But besides for those type of loud events, day to day, certain people through their profession are exposed to loud noise. So whether it be dentists with their dental equipment, musicians who work obviously with loud music, contractors who work around loud equipment, anybody who is exposed to loud noise should wear hearing protection. We also have to protect our ears from water. So if you're a type of person who likes to swim or surf or go in the ocean, wearing swim plugs is very important so you don't develop any type of ear disease from the cold water. And we do make custom earplugs to fit the needs of anybody who needs to protect their ears, whether it be for musicians, dentists, swimmers. And we make them custom made now using a 3D scanner of the ear. We no longer use the silicone impressions. We have a 3D scanner, like a little camera that goes in the ear that maps the ear. And we can build any type of custom hearing protection or earplugs for your ears.
That is really cool. How does water damage the ear?
So for some people, it's a matter of comfort. They don't like to get water in their ears, but the cold water, specifically ocean water, can cause swimmer's ear exostoses, growths in the ear canal. And for children, if they have tubes in their ears, they're not supposed to get water in their ears. So we can make them earplugs as well. Right,
but the cold water itself intrinsically damages hearing. Is that?
No, it can just damage, and it can cause damage to the ear canal, like an external ear canal.
Oh, an external ear infection. Right. Oh, interesting. Okay. So who should get a hearing test and when should they get a hearing test?
Okay, so let's first talk about the pediatrics, then we'll move to adults.
Okay.
So for pediatrics, they should have a routine hearing screening on a regular basis, starting from the newborn hearing screening and then at different stages before they start school. Usually that's done in the pediatrician's office. Each pediatrician's office uses a different type of screener, an OAE screener, a pure tone screener. And if they fail that screening, they should be referred for further evaluation. But aside from that, children who may be at risk for hearing loss. Go ahead.
I just want to go back a little bit and tell us the difference between those hearing tests and what could cause them to be inaccurate.
Okay.
This happens all the time in pediatrics. We do screening and we do get kids who fail, but they have no hearing problems.
Correct. So the OAE screener does not need the child's participation, but it is, if there's noise in the room, it can be inaccurate. If the equipment's not calibrated, it can be inaccurate. And the pure tone screener involves the child responding to you. So with any pediatric, that depends on the mood of the child. So if the pediatrician is concerned, they can try to repeat the screening a few days later. And if the child doesn't pass, they should be referred for a full audiological evaluation, even if it's just to rule it out. Because hearing loss can have long-term effect on speech and language.
Right.
So it is important to just make sure that their hearing is fine.
Right.
On top of that, any child who may be at risk for hearing loss, if they have a speech and language delay at poor academic performance, we should always perform a full audiological evaluation to rule out hearing loss. If they have history of ear infections, enlarged tonsils, adenoids, then they need a hearing test to rule out any type of conductive hearing loss, which even though may be a different type of treatment, but can also cause long-term speech and language effects if they're not treated properly.
Right. One thing I hear a lot of parents say when I bring this up is, but I'm sure they hear fine. I called them and they turn or something like that. Like the parents are convinced that they don't need to worry about that.
So there are different types and degrees of hearing loss. So a child who maybe might have a more mild hearing loss may respond sometimes, or may respond if you're calling them loudly. But if even with a mild hearing loss, or even just with a conductive hearing loss that's not treated, that can affect them. Children are learning their speech and language. So if they're not hearing everything properly, they're not going to develop their speech and language properly. And then that may affect them in school, socially. So it's important to identify that and discuss treatment options.
And what's the difference between a sensory and a conductive loss? Can you explain what those are?
Sure. So a sensory neural hearing loss is a hearing loss that is a more permanent type of hearing loss. And the issue there is usually in the inner ear or the cochlea or the hearing nerve. That type of hearing loss is usually treated with hearing aids and the like, which I think we'll discuss later in our talk. And a conductive hearing loss, the root of the hearing loss is either in the external or the middle ear. So that can be something as simple as wax. That could be something like fluid in the ears that may be needed to be treated with tubes. It can be something more complicated, such as cholesteatoma, something anatomical. But with that, we first would defer to our colleagues, the otolaryngologist and ENT, to rule out any medical issue to be treated. And if it's not treated medically, then we talk about hearing aids.
Right. And another question parents ask is, well, they had a hearing test as a baby and they passed. So why would I worry about a hearing loss?
Okay, so the newborn hearing screening is very important to identify any congenital hearing loss, but there are types of hearing loss that we call delayed onset, that can a child can develop hearing loss later at 1 year old, 2 years old, 3 years old, whenever it is. So that is a possibility.
I'm going to allow you to move on to adults in just a minute, but I do have another question brought up by a friend of mine who actually specializes in sign language and hearing loss. And she said some people will pass their hearing test, but they really still struggle in noisy environments.
And are you talking about children or adults?
I think she was talking about adults. I mean, I don't want to go down the rabbit hole of auditory processing, which is not the same thing as hearing loss, but I don't think she was referring to auditory processing. In other words, when you don't know how to interpret the sounds that you can actually hear. She said some people, when it's a very perfect, pristine environment, they're passing, but they have some kind of impairment.
Okay, so yeah, when we talk about adults, we can talk about that in more detail, but having difficulty hearing in background noise can either be a sign of early stages of actual hearing loss, like high frequency hearing loss, or
Mhm.
it can be its own separate thing. Yeah.
Mhm.
So we do test that.
Okay, so let's talk about the tests you do. I mean, like we talked a little bit about the test that could be done in a doctor's office. I presume you have more extensive testing.
Correct. So let's talk about for a minute which adults should get tested, and then we'll get into the
Okay.
testing. So adults, any adult over the age of 55 should probably have a baseline hearing test, just to get a baseline, see where they're at. But hearing loss can occur at any age, even in a young adult, for various reasons. So if you're experiencing any signs or symptoms of hearing loss, such as difficulty understanding conversation, or as you said, difficulty hearing when there's background noise, people seem to be mumbling, maybe difficulty hearing from a distance, trouble hearing high frequency sounds such as women's voices, children's voices. If you have ringing in the ears, vertigo, anything like that, you should come in for testing. So what does the testing involve? So we do a full audiological evaluation, which includes the standard hearing test where you listen to different pure, what we call tones or beeps of different pitches of sound to see what level you're able to hear. We also have you repeat words and sentences to see your comprehension or processing of the sound, which is the most important. And we also do a couple of testing that test the anatomy of the ear. We do what's called acoustic emittance or tympanometry, most commonly known to look at the eardrum movement. We do acoustic reflexes to rule out any medical involvement as well. We do something called otoacoustic emissions, which looks at the inner ear. So based on all of the results of all the different types of tests, we can determine what type of hearing loss it is and what the treatment options may be. Now, for children, which I know you're particularly interested, depending on the age, not every child can do this full hearing test. So obviously with an adult, we know, you hear the beep, you raise your hand, you press a button, but depending on the age of the child, that's not an appropriate test. So for young children, we do something called VRA, which is their speakers and in the sound booth with sounds coming out. We're talking to them, singing to them, and there are lights turning on to try to train them to turn to the sound. It's basically classical conditioning type of testing. For older children, we do what's called play audiometry, where they have a type of game that when they listen to the sounds, they either put the peg on the board or put a block in a box or something like that. So we gear the testing for the age of the patient.
Awesome. Okay, so let's move on to some common problems that we're actually hearing more of lately. I don't know if you're hearing more about people having tinnitus or ringing in the ears.
Yeah, so tinnitus is a very common complaint. Usually it is a symptom or a side effect of hearing loss, any type of hearing loss, but particularly noise-induced hearing loss. So you may have experienced where you go to a loud concert or a loud event and you come out and your ears are ringing and then it goes away. You feel like you can't hear, then it goes away. But over time, that can become more permanent. But any type of hearing loss can be associated with ringing in the ears, and the ringing in the ears tends to get worse in certain conditions, if you're tired, if you're stressed. So if you do experience tinnitus, the first step is to have a hearing test, and then we could find some solutions for you.
What are some solutions for it?
So unfortunately, there is no cure for tinnitus. So if a person actually has hearing loss, then we're able to manage the ringing and the tinnitus as well with hearing aids. If it's just the tinnitus, then there are certain type of, maskers, masking noise that we can recommend to try to mask out the tinnitus. If it's very bad, if it really causes the person a lot of anxiety or distress, sometimes we do refer them out for therapy, such as cognitive behavioral therapy, to try to manage the tinnitus.
Do we know what causes it?
I think that's debatable, and but what we do know is that whenever there's one of my professors said this when I was in school, is when there's any type of damage to the ear, whether it be a sensory neural hearing loss, whether it be your ears are just congested or anything like that, usually that can cause the tinnitus. I don't think anybody knows exactly where it comes from or why it happens.
But maybe like a post-viral phenomenon, possibly?
Well, yeah, any type of virus that can cause a sudden hearing loss or hearing loss can also cause the ringing.
Mm-hmm. Are there
So,
specific viruses known for that? I mean, I'm hearing it more after COVID. COVID does everything
yeah,
apparently.
yeah. So, any type of virus. So, there is something that's called sudden sensory neural hearing loss or sudden
Mm-hmm.
hearing loss, which we were going to talk about, but
Yep.
that is usually viral. And that is considered an emergency situation. If you wake up one day and you feel like you're not hearing out of one ear, don't wait. Call an audiologist, call an ENT, or call your primary care to refer you out. But so it could be any type of viral infection. It could be from a cold. It could be, so COVID is a virus like any other virus.
Right.
And we are seeing people that have hearing loss and tinnitus following COVID.
Right. I know some people have brought it up after the vaccine, the COVID vaccine as well.
I think that it's anecdotal. I don't know if there's any enough evidence yet to say that the vaccine can cause hearing loss.
Right. I don't think that there is. I think that the problem is that something that happens commonly, we're giving the vaccine to like the whole world.
Correct.
And this is not an uncommon problem. I don't know if you know the incidence off the top of your head of tinnitus. I'm guessing it's not uncommon.
I don't have the numbers in front of me,
Yeah.
but it is very common.
Right.
I think from the vaccine that is anecdotal, but there is evidence following the COVID virus itself,
Right.
That there is documented hearing loss and tinnitus.
Right. And I know that they've studied the COVID vaccine related to sudden unilateral hearing loss and have not found a connection, even though it's also been reported, because again, it's not terribly uncommon. We can move on to the sudden hearing loss. I don't think it's terribly uncommon. I know someone it happened to,
Correct.
and originally they blamed the vaccine until, I showed them very good data that it's not connected.
Yes, I also had someone in my office about a week after she had the vaccine.
Mhm.
But there's no evidence to say that it was from the vaccine because, working in an audiology practice or, I work closely with ENT practices. So we see sudden hearing loss quite often. A person can wake up one day for whatever reason and have a hearing loss in one ear. And so, the ENTs will give them some sort of cocktail of different medications, usually prednisone or possibly some type of antibiotics. And we hope that it gets better and it improves. Sometimes, unfortunately, it doesn't. And then we treat the hearing loss.
Mm-hmm, mm-hmm.
But
Right.
if there is any chance of it getting better, it's within, the first 24, 48 hours. So that's why I'm saying it's considered an emergency situation. If that happens, don't wait a week, go to the doctor right away.
Right. It's maybe like a post-infectious kind of autoimmune kind of phenomenon. Do we know?
I think it's more viral than autoimmune.
So the virus itself.
Yeah.
Wow.
Yeah.
Wow. So
and that can affect the hearing nerve and the vestibular nerve. So that's why sometimes people will wake up feeling clogged in the ear, like they're not hearing, as well as possibly some type of vertigo or dizziness, because the hearing nerve and the vestibular nerve are very close to each other. So the virus can attack both at the same time. So you might wake up, not hearing well, having ringing in the ear and dizzy, and that's usually a sign.
Wow. You should also go to your primary care or an ENT as well as an audiologist.
Well, correct. Yes. So whoever you can get to first.
Yeah.
Because as an audiologist, I can do the hearing test, but then I still will have to refer onwards to the ENT or the primary care to prescribe the medication.
Right.
So, yeah.
Right. But I just want to point out that the way we know that something is not connected to something else with the amount of information we have is to look at the base rate, and it's not an uncommon problem, and compare it to people who've been vaccinated to people who have not. And there is no increase there from this particular thing. Like we know that, you can have a sore arm. I mean, obviously it's the most obvious thing, but there are some other things that are associated, right? You have increased risk of allergic reaction, for example. We know clearly, I'm just giving obvious examples, but they have actually done studies, large studies, where they know that it's not above the base rate. So people should not falsely attribute sudden
Correct,
hearing loss
correct. So
to the vaccine. Let's
while
make that
obviously,
clear.
yes, yes, while this is not a podcast about, the COVID vaccines, but it
Right.
is, the rate of, hearing loss and tinnitus is much higher following COVID itself than following the
Right.
COVID vaccine.
Right.
So we'll leave it at that for
I
now.
just don't want to leave doubt. And it's something that's been discussed. And I think it's really important to discuss any concern. If someone says, hey, I heard that we should discuss it. And these are not uncommon problems, both sudden hearing loss and tinnitus.
Correct, correct.
Okay. So let's talk about why not just go to Costco to get your hearing aid.
Okay, or order it online or over the counter or anything
Right.
like that.
And it's important. I mean, I'm not here to advertise anybody. I always say that. But my same friend, the sign language interpreter, said, make sure you talk about this. It's important.
Yes, please. Okay. So while there might be a place for an over-the-counter device, and just to make it clear that the over-the-counter devices right now are not hearing aids, they are personal sound amplifiers. So they're just raising the volume a little bit. So that's different than a hearing aid. Now, why should you see an audiologist or an ENT? Because like any medical condition, you want to be checked out by a doctor. You want to have a full evaluation. You want someone to look in your ears. You want to rule out any medical conditions, and you want to know what type and degree of hearing loss you have. I mean, the over-the-counter devices are just set at a certain level, and it's not appropriate for every person or every type of hearing loss. But just as important is the fact of getting the personalized attention and care from an audiologist, from a doctor. So, it's more than just the device itself. It's what we call in audiology the hearing journey. So we really get to know each person, what their communication needs are. Is the hearing loss affecting them at home with their family? Is it affecting them at work? Most people are very hesitant to come in for a hearing test, as I'm sure you know. The statistics are that on average, a person waits about 7 to 10 years to go for the first hearing test from when they first notice they have some trouble.
Wow.
So that's part of what we do here, and in a private practice, in my practice, I take the time to address each person's concerns about, their hearing and their needs. And after we discuss all of that, we can get to the treatment and what type of solutions it is, whether it be a hearing aid or whether it be something else. So you don't get that going to Costco or buying something online or over the counter.
Right. I think about it as sort of like the equivalent of reading glasses. If
Correct.
you just need
it's
a little bit
starter.
of, close sight, vision for reading, and that's the only slight problem you have a very slight, very mild hearing loss, that amplification might be all you need. But
Correct. So, I mean, the FDA criteria, for the physicians out there are these, at least the devices that are out there right now, they are meant for someone who has a perceived mild to moderate hearing loss. So we don't know what it is. It means, like you said, someone feels they have a little bit of difficulty,
right.
Nothing else, that might be a good starter device. But for most people, they may have either a more severe hearing loss, or they may have a medical condition that needs to be checked out by a doctor before they get prescribed a hearing aid.
Right. And I mean, all of these conditions are gradual, and you don't notice, right? When you're living day to day, you don't notice a slight change to a slight change to a slight change.
Correct.
So what does that do to someone who is experiencing a hearing loss that they are not properly being treated for?
Sure. So we do know that hearing loss can affect a person's overall health. So from many aspects, starting from something physically, such as a person with hearing loss can be more at risk for falls or something like that. But also socially and emotionally, people who have hearing loss tend to become more isolated. They don't want to go out to socialize because they can't follow the conversation. And the biggest topic now that's being researched is how hearing loss affects adults cognitively, how it affects their brain performance, their cognitive performance. So we know that untreated hearing loss is linked to further cognitive decline. Because what happens is a person with hearing loss has to exert a lot more effort to hear. They're using their brain power just to hear. And the opposite, if someone has cognitive decline, they may not be able to focus as well to hear. So there's a lot of research out there right now, studying adults from an early age. And we're not talking about the elderly. We're talking about people, like we said, in the 50s and older, even people with mild hearing loss that can start to affect their cognitive performance. And something interesting now that I'm starting to use in my office and many audiologists are using, we are incorporating a cognitive screening into our audiological battery of testing. So I use a device called the Cognitive You Thrive, which was not developed for audiologists. It was developed to be used in different fields. It is purely a screening. I am not a neurologist. I cannot diagnose any cognitive decline, but we do incorporate that into our battery of testing. So it is important not to wait till the hearing loss gets too bad, or at an early age, if you notice anything, to come in right away and do a baseline testing.
How would you know that you're seeing a decline from one test? Are you following them over time?
So yeah, any person who comes in for their testing, we do recommend, if their hearing is normal, I set a certain amount of time when I think they should come back. But if they have any type of hearing loss, even very mild, I do see them on a yearly basis to follow their hearing. And if not, or I tell them if they notice a more severe decline, they should come right in.
Back to having trouble hearing in a noisy environment, would that be also potentially a sign of gradual hearing loss?
Yes. So the most common complaint in beginning stages of hearing loss is hearing in a noisy situation. Because if you have mild hearing loss, you could probably hear fine if it's quiet and someone's facing you and there's no distractions. The most common, not the only type of hearing loss, but the most common hearing loss due to aging and noise exposure is a high frequency hearing loss. And the high frequency sounds is what allows the brain to filter out what it wants to hear, speech and conversation, from the background noise. It also helps the brain localize which direction sounds are coming from. So when a person starts to have even mild hearing loss, they can start to feel it first in a noisy situation. So we say, come in if you're experiencing those symptoms.
Right. I have to go back into the rabbit hole of auditory processing for a minute.
Sure.
Anybody who has auditory processing problem may be thinking, but I have that all the time, right? Because people who have trouble with processing, language, not processing language, but processing speech, right? May have trouble, distinguishing different strains, right? Like what people are saying in the background. And that's not a hearing problem.
Correct.
So
yeah, so just to define again what auditory processing is, and that applies to children and adults. So for children, because I get a lot of calls to my office about auditory processing. So in auditory processing, we have determined first that it is not a peripheral auditory problem, meaning that their hearing is normal. So if their physical anatomical hearing is normal, then they have a normal hearing test, but they're still having trouble processing auditory stimulation, speech, and all of that. They may have an auditory processing disorder, and there is specific testing for that. But if a person has hearing loss, they don't have auditory processing disorder. They have hearing loss, which, they obviously have difficulty processing sound. So for children, audiologists can do an auditory processing evaluation to determine if that's what the issue is. For adults, some adults can have auditory processing that they had as children that were never diagnosed. And there's something now that they're labeling hidden hearing loss, which probably similar to auditory processing, where you do a hearing test and everything's normal, but you're still having trouble in background noise. But that, so for adults, there's different solutions than for children. I mean, for children, we have to worry about them in the classroom, and we would recommend them sitting close to the teacher using an FM system, something like that, to help them in the
just to
classroom.
let people know, an FM system is where the teacher's words are piped right into a little earpiece for the child.
Correct. Yeah. So it's not a hearing aid. It doesn't provide amplification, but it helps to overcome the noise in the classroom and the distance. So yeah, the teacher's wearing a little microphone and the child is either wearing a little earpiece on their ear or a little speaker on the desk in front of them, so that the teacher's voice is right in front of them and there's less distraction.
Right. They don't have to filter it through the other classroom sounds.
Correct. Correct.
So I'm just wondering, maybe what's happening is in some people or children, they don't pick up a mild hearing loss. And maybe it gets worse, or maybe it interacts with the processing, or in adults, maybe they always had a processing problem that they compensated for, and then they had hearing loss as they got older and they could no longer compensate.
Correct. Correct.
Do you
But
test
also,
for auditory processing? I'm sorry, do you test for auditory processing?
I do not do that in my office, but I do
Mhm.
have a list of audiologists
Okay,
that
great.
I refer to. Yes, that is not my specialty, but I do have a list of people to refer to.
Right, right. I think it's more relevant for kids than adults in terms
Correct.
of what you can do about it. You know, there are some various retraining programs. I don't know if they're really evidence-based. I don't know if people are still doing there was a fast forward program where you spend a lot of time.
Yes, I think the point of getting a diagnosis for a child is that they get the proper therapy or, solutions in school. So whether it be using an FM system or whether it be them having, a private teacher, maybe pre-teaching them before the class. So to give them a heads up, and getting that and their IEP or whatever they need for
Right.
school to make sure they get the proper help, because that child can do well academically with the
Right.
proper support.
Right. But I think for adults, if they've been doing well all along and now they're having trouble in noise, it might just be that they always had auditory processing and now they have some degree of hearing loss, but for them, maybe it throws them over the edge.
Right. It might be, like I said, this is new research into what we call hidden hearing loss for adults, which is their audiogram is normal, but they're having trouble in background noise. And we're still trying to determine what the cause is. It can be, beginning stages of hearing loss where the little hair cells in the cochlea are starting to be affected first before we see it on the audiogram. So it's still not fully known, but it is a phenomenon that we're researching right now. And that's why part of the testing that I do, besides for doing the hearing test, is a speech and noise testing for adults. So, we play it through the speaker and it simulates like what we call a cocktail party effect, where there's a lot of people talking in the background. And then one person says a sentence or a word, and you have to repeat that. And we see how the person does on that test. So that tells us a lot about how a person can process sound. And as I mentioned before, that we're doing the cognitive screening. It's interesting as I'm doing the testing to see the association. So people who may have difficulty with speech and noise may also pour scorely on the cognitive testing. So it's all related, which is
right.
The bottom line is that it's all related, and hearing loss can affect you really overall. So it is an important thing to get tested.
Right. This hidden hearing loss is very interesting. I've never heard of it. What do you do if we don't really understand it and their hearing test is normal? How do you help them?
So for each person is different depending on where it's affecting them. So I've had people like at work, for example, they need to be at a busy conference meeting, or I've had lawyers where they need to hear in the courtroom or whatever it is. So there are devices similar to the FM units that are used for children, but we have different FM units, or what we call remote microphones for adults. So they can wear something and give the microphone to the person who's speaking at the meeting, or there's now a table microphone that can pick up people's voices around a table. So it really depends how much it's affecting their daily life and in which situations we're able to help them.
That is absolutely fascinating. That really is so interesting. And the bottom line is function. So you help people function even with this problem that we don't fully understand. So that's awesome.
Right.
Okay. So we actually have time to go back to the kids, which is my comfort zone.
Okay, that's fine.
And talk about treatment of children with hearing loss, which I did not cover really with Dr. Geller.
Okay, so most importantly, which I think you did cover with Dr. Geller, is the early detection, which then leads to early treatment. So just to recap quickly, every baby should have a newborn hearing screening, okay? It's just a screening, like any screening. So if they fail the screening, they need to follow up. So yeah, sometimes it's just fluid in the ear, but sometimes it is actually hearing loss. So the criteria, or what we call best practices, is they should have their follow-up screening by age 1 month. They should have a full diagnostic testing by age 3 months, which for babies is usually an ABR, auditory brainstem response testing. And if we find that they have hearing loss, they should be fitted with hearing aids or any type of treatment by age 6 months. Okay.
Can we go back for just a minute and explain what
Yeah.
an ABR is? In the newborn nursery, they
Sure.
use what technology, first of all?
So in the newborn nursery, well, it's going to differ from hospital to hospital, but the
Mhm.
most common is that in a well baby regular nursery, they use something called an OAE screening, otoacoustic emissions. Babies that might be at higher risk for other neurological disorders, or maybe were in the NICU for whatever reason, born early, or have other medical conditions, we do the ABR testing, because that tests all the way up to the auditory nerve. So they will do an ABR screening.
Auditory brainstem response.
Correct. So if they fail either of those screenings, the full diagnostic test for a baby is something called an ABR evaluation, or diagnostic evaluation. What we do is we place electrodes on the baby's foreheads and behind the ears, little earphones in the ears, and we present sounds, and we can measure the brainstem's response to those sounds and determine if they're hearing in the normal range or if they have hearing loss. Obviously, a baby can't raise their hand and tell us when they're hearing, so we need to do it that way. If we do find that they have a sensory neural hearing loss, then the treatment would be hearing aids or cochlear implants, which I know you wanted to discuss the difference, but we want to do that by 6 months. Go ahead.
I'm sorry, I just want to go back just a minute, just make sure it's clear. So when you do the ABR, you are just testing for sensorineural. You're not testing for conductive, are you?
We can. So the ABR can help us determine what type of hearing loss it is. So we can do a bone conduction ABR similar to bone conduction testing. So once we determine, if the ABR is normal, it's normal. If we find hearing loss, then we go on to the bone conduction portion, and we can determine if it's conductive. So even a baby can have fluid in the ears or something else. And obviously then we need to deal with the medical aspect. But I think you're asking more about a child who has sensory neural hearing loss. I think that's what you were asking.
Right.
So we want to make sure that, so we want to make sure to fit that baby by the age of 6 months. That's the gold standard, because babies are hearing from the day they're born, and they're learning their speech and language from the day they're born. So the earlier we fit them, the better chance at developing their speech and language they're going to have.
Very, very good to know. Can kids acquire hearing loss? I mean, again, I always hear, well, they passed the newborn hearing screen.
Yeah. So, there is something called delayed onset hearing loss, and that can be caused by different things. That can be even a genetic cause. So if someone has a genetic hearing loss, it may be something that they're born with, or it may be a delayed onset type of gene. There are also certain childhood or infant viruses, such as CMV or other viruses, that can cause hearing loss right away, or can cause hearing loss within a few months or a year afterwards. So we discussed the babies that are high risk. Those babies, even if they pass their hearing screening, usually will get some sort of protocol to follow up in 6 months or a year to test their hearing later as well. There are also, children can develop hearing loss from other things. They can develop conductive hearing loss. They can have taken certain medications, certain strong antibiotics, or if a child needs chemotherapy or something like that, those types of medications can also cause hearing loss. So children can develop hearing loss at any point in their life for various reasons.
Right. And I know as a pediatrician, we follow a schedule of hearing tests at various periods. So you talked about a hearing aid, but we did not talk about a cochlear implant.
Correct.
About that.
Okay, yes. So hearing aids and cochlear implants are different type of devices to treat hearing loss. So a hearing aid is an acoustic device. You wear it in the ear, over the ear, but it sends sounds into the ear acoustically through the natural pathway of how we hear sounds. Now, for some people, a hearing aid is not enough. And that the criteria is different for children and adults. But let's say, we're talking about children right now. So if a child's hearing loss is more severe, okay, severe to profound, we know that a hearing aid is not going to help them enough, because it might help them detect sound, but maybe not understand all of those. So we are doing cochlear implants in babies as young as a year. I think as young as 9 months now, they're doing cochlear implants. So a cochlear implant is a surgical procedure. It is a device. It's an electrode array that's implanted into the cochlea, and it bypasses the natural pathway of the ear. It sends electrical stimulation directly to the hearing nerve and to the brain. So it's a different type of hearing, but for a child especially, their brain adapts to it right away. And if it's done early and there are no other, developmental delays, it's just this, then, they have the potential to develop speech and language, normally. And then for adults, so adults is interesting because for adults, it's usually postlingual, meaning they already develop their speech and language, but they start to develop gradual hearing loss. So if a person's hearing loss is progressive, so it gets worse and worse over time, where they may have started out with hearing aids, but their hearing loss may get to a certain degree where hearing aids doesn't help them enough. And the way you would know that is when you're wearing hearing aids, but you're still having trouble hearing and understanding. That's the most important thing. If you're still having trouble understanding conversation, even with your hearing aids, you may be a candidate for another type of solution, which may be a cochlear implant. So that's something to discuss with your audiologist if you're having trouble even with your hearing aids.
Right. Can you also have sudden bilateral hearing loss? Does that happen?
Yes, I have seen that. Or it starts in one ear and then the other ear. Now, we didn't discuss some of the other medical conditions associated with hearing loss, but, besides for sudden hearing loss, there can be something like Meniere's disease or other types of hearing loss that are progressive over time and get worse and worse. And that can lead to a cochlear implant eventually.
Right. And we also forgot to list the conditions that adults could be at risk for a more extensive hearing loss. I'll give you a chance to throw that in there now.
Okay. Okay. So besides for just any adult that's over a certain age that should have a baseline hearing test, but certain medical conditions can put a person more at risk for hearing loss. And those include any cardiovascular disease, diabetes. We know that blood flow can affect the inner ear as well. So that can be risk for hearing loss. Kidney disease can also be a risk factor, and any type of noise exposure like we discussed before, and anybody that has vertigo or Meniere's disease, something like that, can develop hearing loss over time. So if you have any of those medical conditions, you're probably being sent for a whole array of testing, vision testing and all of that, but hearing testing should be one of the testing.
It's important to know. But back to the cochlear implant. So adults can get those. Do they do as well as the kids? I mean, because I think people may not be aware that when you have a cochlear implant, it's not simply restoring your hearing.
So there's factors that can affect, how well a person does with a cochlear implant. So the factors for an adult. So for a child, like we discussed, the earlier you do it, the better. The more potential you have for your speech and language development. But for an adult, it really depends on a few factors. One of them being how long you have had your hearing loss for. So, is this a sudden hearing loss? And more importantly, during the time that you had the hearing loss, did you have stimulation to the hearing nerve? So, did you wear hearing aids that whole time? So as it got worse and worse, you will do better with the cochlear implant because you were hearing over all of those years, your hearing nerve was stimulated. You would be, the prognosis would be better for somebody who wore hearing aids during the time that they had their gradual hearing loss, which is very different from adults who were born with a severe to profound hearing loss, or, were deaf from a young age, maybe use sign language, maybe when they were children, cochlear implants was not available. and now they want to get a cochlear implant. So their prognosis is different. Their expectations should be different. Many of those adults want the cochlear implants to be more aware of their surroundings, maybe for safety, to pick up sounds, but they're not necessarily expected to all of a sudden be able to hear speech and understand speech if they were using sign language for the many years until now. So that's different than an adult who had hearing and then lost their hearing.
Right, but even for that person who had hearing and lost their hearing suddenly as an adult, would getting a cochlear implant just give them their hearing back?
Yes, so it is a process,
Mhm.
but if they do it pretty soon after they lost their hearing, they can gain up to 80 to 90% back of their speech recognition. Again, as we discussed, the cochlear implant is a different type of sound than the hearing aids. So it can take a few months to get used to hearing that sound, for the brain to get used to it. And we incorporate the sound slowly. We'll turn it on a lower volume and slowly increase. But yeah, they are able to understand speech again in most cases.
Right. The reason that I'm pointing this out is because, somebody should not have the unrealistic expectation of, there are these videos, YouTube videos of
Yes.
babies who are getting their cochlear implants and it's turned on. I'm like, wow. I mean, they're insane, right? They're so moving. But it's a process of learning how to interpret the sounds. It's not an
Correct.
instantaneous thing. I just want to make sure people understand that.
Yes, it is a process. And anybody who is considering that, usually will have the support of the audiologist, support of the cochlear implant surgeon, and a whole team to walk them through the expectations and the process, and even speaking to other people who have had cochlear implants to find out what it was like.
Right. I want to talk for a few minutes, take more of your speech and language background and talk about speech learning in kids with severe hearing impairments. Because we mentioned sign language, but we didn't talk about that. And I'm going to just allude briefly to the concept of deaf culture. There are some people that don't
Correct.
believe in restoring hearing or using cochlear implants. They believe in using sign language, and there's a whole deaf culture, and that's
Sure.
really outside the parameters of what we can do. And I'm really hoping to interview someone who is deaf
Yeah.
to teach us about that. And more
Yes, so we
awareness.
won't go into details about that, but that is something that, if a child is born with that degree of hearing loss, so that obviously is the first conversation that you have to have with the parents, is which route they want to go. And if they belong to the deaf culture, then that is what they're going to do, and that is what we're going to respect. And if they don't want to do a cochlear implant, I mean, that's their language and that's their culture. So, that's not my specialty, and I hope you will interview somebody, because that is a whole other topic that needs to be discussed.
It is. It's important.
It's very important. And I have dealt with families and patients, and if that's what they choose, that's, they may be fit with hearing aids, maybe not with cochlear implants, and their child will grow up with sign language. But if we're talking about going, to oral or spoken language, then now with cochlear implants, that has opened us up to the fact that children, hopefully, that have a cochlear implant can start to hear much earlier in life, and can develop their speech and language even, in a regular classroom. They may not have to go to a special school, for the hearing impaired. So, they would obviously need to work with a speech pathologist and, choose the type of therapy that they want to pursue to develop their speech and language.
Mm-hmm. Yes. So I do want to make one point, though, or ask you about your opinion about this, that even if your child is going to be getting a cochlear implant, should they learn sign language as well?
So that depends on the family. So if and the school that they're going to attend. So if the family doesn't communicate with sign language, who is going to teach them the sign language? If they're going to go to a school that teaches sign language, then yes. But we monitor if the family wants them to be oral and just use spoken language. We have to monitor, if there are some children, it's rare, but there are some children, for whatever other developmental reasons may not develop their speech and language, even someone who doesn't have hearing loss. So then they may use sign language for those children.
I'm going to put in a plug here because I feel like this has become so polarized,
Mhm.
right? It's either you're oral or, you use sign language. I have to say, as a pediatrician, a lot of my parents are teaching their kids sign language just as part of helping them communicate at an earlier age than they can actually
Right,
speak words.
regardless of hearing loss, maybe a child who has speech and language delay for some other reason, or just to help them communicate.
Right. No, not
Using
children with speech
gestures.
problems. Right.
Okay,
Yeah,
just gestures or sign language, yeah.
right. So, I think some people are thinking, oh, if I teach my child sign, they won't speak. And research shows the opposite, that it helps them communicate. They're communicating from an earlier age than they would be by being able to say words clearly enough. And that's for children who are not developmental delayed and children who are not with hearing loss. So to me, it's a kal v'chomer. That's how I look at it. How much more so for kids who have hearing loss? Why not teach them sign language? Because they have to wait anyway to get the cochlear implant. They're not getting it from birth.
Correct. To me, it's like learning two languages from a young age. So, you can be speaking to your child in English and Spanish. You could be speaking to your child in English and Hebrew, and you could be communicating with your child in English and sign language. So a young child can pick up two languages at a time.
Yes, they can. And that's also a myth that if you have two languages, your child will be speech delayed. That is completely not true.
No.
Number one. But number two, the concern that I have, and again, this is my friend who made me bring this up, who was a sign ASL interpreter. She said it's really, really important for kids, even those who are getting a cochlear implant, to have that option of ASL, to have the sign language. And I, as a pediatrician, think so too, because kids are learning language from the earliest ages. And while they're waiting for that cochlear implant and they're not getting any sounds coming into their ears.
Well, they are getting sounds through a hearing aid. Usually we will fit them with hearing aids. It's not the same type of sound they're beginning with a cochlear implant, but we always fit the babies, even that are planning to get a cochlear implant, will wear the hearing aids till they get the cochlear implant. So at least they're getting some type of sound stimulation.
Right. But I don't, yes, that will help the nerve and help it develop and help
Correct.
them
But you're
respond to
talking
the cochlear implant. I'm
about
talking about language.
You're talking about language. Correct. Correct.
Yeah.
So yes. Now, one of the important things to say is that a family who has a child with hearing loss, especially this severity of hearing loss that is planning to go for a cochlear implant, there's a whole support system out there. So it's the pediatrician, it's the audiologist, it's the implant surgeon, but even more important than what we do is their day-to-day support for language. So whether it be a speech therapist or whether they get involved in an early childhood center, there are preschools out there that also have programs for infants. So, a mommy and me type of program where they go and the parents are guided to how to help their children develop speech and language, because even an hour of speech therapy is not enough. Someone needs to be communicating with the child all day. So whether it be just speaking, oral communication, or sign language, there needs to be a whole support system there for that family.
Right. That's a really, really good point. And it's a really good time to end because you've given us a lot of information. And I do hope to interview someone who is deaf to teach us more about deaf culture and, that other perspective that we're not able to do today.
Yeah.
But this is really great information. I'm going to have you tell us where we can find you.
Sure. Okay. So my office is located in Lynbrook, New York. And like I said, I see patients of all ages, from children up to adults. And you can find us by either calling the office. Do you want me to give the phone number?
Sure.
516-387-4000, or you can go on our website, which is comprehensiveaudiology.com, and we have a very easy scheduling system there. You can schedule an appointment online. You can also email me and ask me any questions that you have.
Amazing. That is so awesome. Thank you so much for doing this with me.
And thank you for hosting me today.
Yes, and good Shabbos.
You too.
All right.